the Gerontological Society of America, Advancing Innovation in Aging. GSA on Aging. I'm Howard Degenholtz, social media editor of the Gerontologist, a publication of the Gerontological Society of America. Suzanne Meeks is a professor in the Department of Psychological and Brain Sciences and PI of the Aging and Mental Health Lab at the University of Louisville. She's also the editor-in-chief of the Gerontologist. I spoke with her about the February 2021 special issue, Gerontology in a Time of Pandemic, Part 1. We also briefly touched on articles in Part 2, which was published online in March. Suzanne, this is a great collection of articles. I am so impressed. Has the Gerontologist ever done a two-part special issue before?
I do not know, but not on my watch.
Not on your watch.
That's, not in the last 7 or 8 years anyway.
I think it really goes to the importance of the issue and really how everybody's attention was put 100% onto this topic.
Yeah, we were pretty overwhelmed with the number of submissions. It was obviously something that, I was kind of surprised that the researchers were on it so fast, that we had submissions almost instantaneously. And this is back last spring, spring of 2020.
Yes, and the papers that I want to talk to you about today are very labor-intensive work. So I'm quite impressed that people were able to produce these and turn them around. And kudos to you and the editorial team for really getting them through the process in a timely way.
Well, our editorial board and reviewers were amazing this summer. They just stepped up and we asked for 1 week and we got it from so many people. Despite all the other things that they were dealing with. So we were very fortunate to get our reviewers on these papers right away so that we could have a quick turnaround and get them out again.
That's really fantastic. So I chose 3 of the articles to talk about. There really is a fantastic collection, but I chose 3 that I thought really demonstrated the breadth of research that is in this issue, which I think is also really emblematic of some of the best work in the Gerontologist. Mm-hmm. So the first paper is National Profiles of Coronavirus Disease 2019, Mortality Risks by Age Structure and Pre-Existing Health Conditions. The first author is Ashton Verdery. Can you tell us, you want to tell us a little bit about this paper, why you selected it, and what is it? What do we think it shows about the nature of the pandemic?
Well, I think one of the most noteworthy things of this paper is that it's international viewpoint, and also it's sort of a 10,000-foot viewpoint of the pandemic. So rather than looking at risk for infection at the individual level, they're looking at country level, and they're able, therefore, to look at age and health as risk factors at a much broader level, at that international level. They had 42 countries in their samples, and those countries spanned Europe and the United States, and but also the global South and Asia. They were all over. And so it was a really broad sample. What they were doing was taking mostly studies that were sister studies to our health retirement study here in the US. And they were able to match data across those many different studies. I mean, methodologically, it was really quite an undertaking to get that out as fast as they did. But what they were looking at was, so we all knew right away that there was this age risk. And we also had been hearing that there were health risks. And the age risk was leading to some ageism that we were seeing in the media and also in social media and so forth. And so they were looking at this again from this 10,000-foot view or higher, to look at whether age is really the factor or health is really the factor, or how those two things interacted. And so if age and health are not strongly correlated as risk factors, then we'd be missing, by looking at age, we'd be missing a huge international risk factor. People would be saying, well, I'm not old, so I don't have to worry about it.
Right.
When in fact, this was a pandemic that might have been affecting many people, not just old people. We didn't really know at the very beginning how broad that impact was. So that is really, I think, one of the main reason why this was selected. And of course, their methodology is sound and appropriately reviewed and so forth. This ability to harmonize data across all of these different countries was, I think, just really phenomenal.
So I'm looking at the list of countries. A couple of thoughts occur to me. One is the importance of age and really teasing age and health risk apart is really important, because there are countries with a relatively older age structure and countries with a relatively younger age structure.
Mm-hmm.
And anecdotally, some countries are doing well in terms of mortality, and some of those countries have a relatively old age structure. For example, Korea and Japan. So that makes us question what is the relative role of age and the health risk of the population. So I'm wondering if where countries that have for examples of countries that have a relatively young age structure, and how are they faring?
So they looked at age risk profile and health risk profile separately. And what they found was that they were not highly correlated with one another. So you had countries that were going to be at risk because of their age structure, and other countries that are at risk for their health structure. And so, for example, if I'm looking at a table that shows your age risk profile, and there you have Japan, Greece, Italy, Poland, France as the top places. But then if you look at the health risk profile, you have the Russian Federation, the US, Portugal, Lithuania, and Poland. The only one that is in both of those lists is Poland. So you have, some that would have kind of moderate risks on both areas, and others that only have risk in one area. And the US is one where the health risk is a greater problem than the age risk.
The United States is a positive outlier on the health risk profile, and it's a little
Correct.
hard to see where it falls on the age risk profile, but it is, it's also, it has a lower age risk and a high mortality risk. So I don't think we're doing that great on both metrics.
No, the US doesn't come out really great.
No. One factor that I don't see in their discussion, they brings it up a couple of times, is the mitigation strategies undertaken by the countries. And we know that countries have really varied in terms of their mitigation approaches. So I'm wondering if you have any thoughts on how mitigation strategies might be operating in these data.
We have, of course, no data from this study about that, so we don't really know. Another of the papers that we're going to talk about actually gives us some hints about mitigation strategies in terms of psychosocial well-being and stress, but not so much in terms of protection when there are these, either age or health risks.
Yeah.
And we certainly know that countries took very different approaches to mitigation. So I haven't seen those data. I don't know how those data come together, I don't recall seeing a paper that brings them together in that
Mhm.
way.
It's almost like we want to take several of these papers and mix them
Right.
together. And
Well, one hopes that these papers are a jumping off point
yes,
for other studies where people can start to do those more fine-grained analyses as data becomes available, and as we see what we don't know.
right.
This is really just the beginning.
There were some studies that came out in the gray literature that looked at international comparisons of self-reported mask use and infection rates that showed, that purported to show that countries where the population was more adherent to the mask use and were having lower rates of infection and consequent mortality. So, one my inclination would be that it would moderate the effect of both age and risk factors, health risk factors on mortality. Um, but that I think you're right. I think that study remains to be done.
Right, because
In a
it's
way
also, you could also pose the hypothesis that they're confounded because countries that are really organized in their mitigation effects, which means they have strong public health infrastructures, would also maybe have better population health.
Well, yeah, I was having the exact same thought at the same time that they do have. So we're sort of talking about the Northern European, Scandinavian countries where you do have better access to healthcare. You also have relatively longer longevity and lower morbidity. So
Right,
there's both health system factors and lifestyle factors that play into that.
right.
Suzanne, what do you think we can learn from this kind of international comparison? How do you think this evidence sheds light on policies and practices in the United States?
One thing that comes to mind immediately thinking about this is that when we only look at our science that occurs within the United States and policies and so forth that are happening within the United States, we really narrow our understanding of these phenomena, and we start to think in sort of um, American exceptionalism way about how great or not great our science is, without seeing all of the other possibilities, the other ways of thinking that different government structures and different cultures and so forth bring to these crises. So that's one piece, and the other piece is just recognizing that a global crisis is a global crisis. It's not just happening to us, it's happening to everybody. And if
Yes.
we think about it as just happening to us, our solutions are not going to be effective, because whatever we do is going to be affected by what everybody else is doing. So this big that's this global view and high level global view can really help us take that broader perspective that gives us additional questions to ask that we probably wouldn't even think of if we were just thinking about what's going on in the US.
Let's shift gears and talk about the second paper in the list. So this is, I love the title of this
Mhm.
paper. This one catches your eye, and I know that was the intention of the authors, but this paper is titled, "It's Pure Panic, the Portrayal of Residential Care in American Newspapers During COVID-19 by Laura Allen." So tell us about this article. What attracted you to it? What's the contribution here?
So I should say that this is the analysis approach in this paper is pretty unusual, at least for what we publish in our journal, and I really appreciated the novelty of it. Um, so I think that's part of it. These are researchers, I should say. The senior author is I don't know how to pronounce his name actually, Ayalon, um, who is very well known in terms of doing ageism research. So I think they were looking at how sort of inherent ageist bias might be affecting the discourse in our American newspapers about COVID-19. But what attracted me to it is the fact that they're working on portrayal of residential care, and I have done most of my research in residential care. They're noting the exclusion of residents' voices in the discourse. I think was the thing that most interested me.
That's a really interesting point. In my own work, we had to go tools down with all of our studies. So we were not able to go into nursing homes to do any interviews, and we're still, we stopped all of our telephone interviews, and we stopped all of our field work, and we still are not, we still don't have a green light to be doing in-person interviews. So it's practically impossible, at least from our team, to do research in a nursing home setting, even into 2020. And I don't really know when we'll have that opportunity. So actually physically, practically getting residents' voices into the story, I think was prohibitively difficult.
It's very difficult. Exactly. Yeah, and maybe we should back up, Howard, and talk about what these researchers actually did, because it's interesting. So they were analyzing American newspapers. So they used 3 newspapers, New York Times, USA Today, and the New York Post. And they were looking at 54 news articles that were published in early 2020 that I had something to do with residential care. And then they used a thematic, a qualitative analysis of the texts in those newspapers.
Right. And they identified several important themes from that analysis. Of course, the first one, as you mentioned, is that the residents' voices are excluded from the discourse. The second was that residents are entirely helpless, that this was a disaster waiting to happen, and that it's just shocking, that it's pure panic. It's interesting because my read on this paper is that they have a toolkit about ageism and studying ageism and the language that's used, and really applied it to this focal moment. And I think it was a very productive analysis. Would you agree with that?
I do agree with it. And it's a very, there's a big contrast. Actually, there's another paper that's in the collection. I can't remember if it's in the February or the March issue that actually takes the perspective of the family members and the importance of the family members and sort of emphasizes that. So this is a really interesting contrast to this other paper, which is arguing for how, family members got left out and they've been so critical, and which is probably true also. I mean, certainly that has been the experience of family members who interact with long-term care. But this one is sort of giving another point of view that suggests that some of that discomfort and pain that the family members were experiencing was overshadowing the actual experience of the residents themselves.
It's interesting to consider how the media coverage of what was going on in residential care in 2020 affected just the way the pandemic was perceived and understood. But also, I think it had an effect on the academy and how researchers went about puzzling out what was going on in nursing homes. I think it put people into a very difficult situation because there's no lack of criticism of the nursing home industry in the academic literature.
Correct.
So, however, one of the things that I saw in as a discourse, from a discourse perspective, was that the academics were being very measured in their language with regard to the industry and were very careful not to avoid saying this is a terrible industry that's completely at blame, because that was the message that was coming out of the newspapers at
Right.
the time. And there were no stars, there were no leaning, or I should say there were very few positive examples and mostly negative examples coming out of the residential care or long-term care facility sector during that time. So I think it had some interesting ripple effects, the way the media coverage played out over the course of the year.
Right. And I think that all could be, that could be a catalyst for change, but also did some damage, I think, for the folks actually working in long-term care, to feel that blame. I think from the perspective of the journal, the thing that I love is that we're showing this perspective side by side, in a sense, with another perspective about the same industry and probably several others and that's why academics are measured, right? Because it's a very complex problem.
Yes.
And we know that. And we know that there are no easy solutions out there, and that having all these different perspectives and sort of weighing all those different perspectives is really the way forward.
I think it'll be very interesting to read the family caregiver paper side by side with this paper,
With this one,
when they're both published. So you said catalyst for action. So I was really thinking about that as I was reading this paper, and I wonder if the really very overwhelmingly negative framing of the industry that comes through in this analysis, I wonder if that has an effect on the policy options that are opened up for consideration in terms of reform. I think I've been saying, and I've been interviewed myself by the media, that there's a possible window for reform in the nursing home sector and also in assisted living sector that's really come out of the crisis. And what I wonder in reading this is whether the language and framing is going to lead to a certain flavor of policies that might be different if the media coverage had a different tenor.
Yeah, you might be right. And what I was thinking as you were saying that, Howard, is possibly more of the same, because the regulations of long-term care are largely already punitive rather than incentivized.
Right.
So it's definitely a punishment-oriented set of regulations,
Right.
and negative portrayals in media, negative public portrayals of an industry tends to lead to that kind of regulation, sort of reactive regulation, in my experience. So that's a little worrisome, actually, because I'm not sure that kind of punitive approach is really going to make much difference. I think that there are the kinds of changes that need to be made are not about tougher regulation of quality of care, but rather innovations in types of care and patient-centeredness. And you're not going to regulate yourself into patient-centeredness. So that worries me actually a little bit.
I agree. That is my concern. I don't know what a future regulatory framework might be, but I think that a system that provides incentives for improving quality of care and quality of life, as opposed to punishing poor quality of care and poor quality of life, would probably go a long way towards achieving that goal.
I agree, but there are also, as we know, fundamental funding problems in the system that, if not corrected, are it's going to be very difficult to make any meaningful reform.
Well, that's kind of the fear that I was feeling as I was reading this, which is, when I say that there's sort of a policy window opening up, one of the policies is that I think is one of the policies that's getting a lot of scrutiny is the way we pay nursing homes. And
Yeah.
the reliance on Medicaid and the cross-subsidizing of daily care and operations through Medicare has led to a situation where the nursing home is really balancing some residents, customers who are money losers, and some residents and customers who are profitable. And the net effect is keeping them very close to being in the red financially. So why do we have a system where Medicaid can reimburse nursing homes for less than the cost of care and Medicare reimburses for comparatively higher than the cost of care? And I think I would like to think that when I say the policy window is opening up, we're going to ask the question of, should that really be allowed? And should we reconsider the financing, at least in this one particular sector of long-term care, to really put the providers on a more stable financial footing? When I think about the policy window opening up, one of the policies that I think ought to be considered is the way long-term care is financed, and notwithstanding the balance between home and community-based services and residential facilities, really putting the different payers on equal footing, I think, is an important policy goal. However, with this overwhelmingly negative framing in terms of how we got into this situation, it makes me wonder if reforming the financing might come as a package deal with even more burdensome and punitive regulations.
Yes, and I think that's possible, because I think there probably are some specific changes that are needed to infection control, for example, that could have mitigated some of the spread of COVID-19 in nursing homes and so forth. And so there are, there needs to look at that, but there always is that risk of the pendulum just going too far. And I think without a big change in funding, the punitive part will be detrimental rather than helpful. It'll be interesting to see what happens. I agree with you. I think there's a window opening. And this is an opportunity for gerontologists to step into that window and try to influence policy, I think. Going back to this article, perhaps also an opportunity for people who are actually living this, people who are in nursing homes and other residential care settings, to be asked what would they like to see differently, and to find out about their experience. When we are able to get into these facilities to talk to people about what they experienced, I think it's going to be really interesting.
I think there's going to be a lot of scholarship that comes out of that experience, finding out what people want in terms of their own living environment and lives, I think, is always important, but also understanding the subjective experience of people who've lived through this will be really quite valuable. I would hope that becomes a leading voice in any reforms that are to come down the pike.
Yeah, I think that would be really a breath of fresh air if that were the case.
Let's shift to this third paper. This is another national comparison. And I selected it, and I wasn't really thinking that, oh, this is another, international comparison paper. But really, I selected it because I thought it was a good example of a body of papers that were really looking at the stress and coping and psychological consequences of the pandemic. And this one happened to be another international paper, but I thought it was particularly insightful and also quite sophisticated from the methodological point of view. This is Social Isolation and Psychological Distress During the COVID-19 Pandemic, a Cross-National Analysis by Hyun-Soo Kim.
Right. And so the authors are in Singapore.
Yes.
I recall correctly. And this one is striking too, because they were not using existing data. So they collected data on perceptions of the COVID-19 pandemic from over 13,000 participants in 62 countries.
That's really fascinating. Actually, I didn't even pick that up. I thought that they were drawing on a study that had been in the field.
I don't think so. I think they, if they had, they were adding on to it. But the study's called COVID-19 pandemic. I mean,
it was launched on March 20th and completed on April 5th of 2020.
Yeah. So, I mean, that's the miracle of the internet.
Yes.
To be able to collect that kind of data is really amazing. And looking specifically at social isolation, which has been bandied about, and we have several papers about loneliness and social isolation in the special collection. But I've also, there's been a lot of back and forth whether social isolation was having an impact on mental health in this crisis. We know that social isolation has an impact on mental health overall. Social isolation can be even deadly for people, and older people included. It's almost anyone, but older people included. So this was interesting that they were tackling these ideas of social isolation and mental health. So of course they are testing that hypothesis that social isolation, due to that physical distancing during COVID-19, was associated with psychological distress, but they're also looking at mediators of that that include country responses to the pandemic. So they asked about, or they looked at countries where there was more mortality versus countries that had less mortality, and also looked at people's perceptions of the, I think it was the people's perceptions
the stringency measure?
The stringency of the measures. I think that was a perception of the respondents that they were looking at, and the state capacity. And also how global the country was. In other words, how many people are coming and going from different areas of the world in the country. So they had a bunch of hypotheses that were well grounded in theories of social interaction and stress, which are pretty well conceived theories that are out there. But so I think that was an interesting feature of the paper was, large data set pulled together really quickly. I saw lots of papers pulled together really quickly. What this one was theoretical, had clear a priori hypotheses to test some of these external influences on people's responses to their restrictions that they were experiencing.
What do you think is the most interesting finding out of this paper?
Okay, well, there were two. And one was this interaction between people's distress coming from the isolation that they were experiencing because of COVID-19 and their perception of their country's capacity to cope with the pandemic. So if they felt that their country was not coping as well with the pandemic, or didn't have the capacity to cope with the pandemic, they were going to have more stress, more distress reaction to being cooped up. And if they thought that their country could handle it, had the capacity, then being cooped up didn't bother them as much. That's a lay translation of that interaction. And then it was kind of the opposite thing when there were very stringent anti-coronavirus policies. People also felt less upset in response to their social isolation.
Well, those seem to be consistent, right? Like
Yes, exactly.
high capacity and high stringency would seem to go together, right?
That's right.
Yeah.
That's right. So, so essentially, what they're saying is that yes, social isolation can be damaging to your mental health. It can create a lot of distress, but not so much if you feel like there's if you feel like your government is kind of on top of it and taking care of things, then people are more willing, I guess, to social isolate, or more comfortable with the social isolation is really what they were measuring. Is they just didn't feel as much distress around being isolated if they felt like their country was able to handle the crisis.
So there are a number of other papers in the collection that are about stress and coping. And I'm wondering if, in your read of this as a body of work, if this is consistent. What it says to me, and you can tell me if I'm on track with this, is that one of the things about stress and coping is that people are exposed to stressors and cope differentially. And some people cope in effective ways and some people cope in ineffective ways. And when your coping strategy is not well tailored to the actual stressor, then that's one of the factors that leads to negative consequences. So a little bit of what I'm hearing here is that, or seeing in this paper, is that those messages that people were receiving and internalizing about the national response in their country was ameliorating some of the stress.
Right. That's how I read it too, and I think that's really interesting. Their conclusion is we need to think about the moderating role of national context in studying how people are responding to a crisis. And and it kind of goes back to that other paper that we talked about, that global level, that it's not just about individuals coping with the crisis or even small communities coping with the crisis. It's about the whole national context in which people experience something like a pandemic.
Right. So it does interestingly kind of comes together, right? Because, well, how do we know what our national response is except through the media?
Mm-hmm.
So the messages that we're getting through the media about how is this pandemic, what's happening with this pandemic, how is it affecting people, and how well is our country or government responding, that does seem to have an effect at the individual level. And it's interesting because it's not just with these international comparisons, what it's showing is that it's an aggregate effect. It's not just, my government relieved my stress. No, the government response in general is leading to lower distress on average at the individual level.
Right. That's what it looks like. Yeah. So there's this interesting interplay between that national and global context and individual responding.
So when we have, to bring back in some of the observations from the second paper, a conversation that's about blame and fault and real failure of government to protect the most vulnerable, that certainly can't go very well towards perceptions of the quality of the national response.
No, and it actually plays also back into the first paper in the sense that if that's where the national press conversation is focused, so the horrible experience of old people shut up in nursing homes, then the national attention is diverted from the fact that, in fact, there are other risk factors besides being in a nursing home or being old that are significant. And therefore, nationally, we're not coping with the broader pandemic. And I think that was a dynamic in the United States. So it's interesting how that plays out.
Yeah, I saw something also subtly different where the reporting on nursing homes and what was going on in long-term care was that it was negative and punitive and critical, as we were just saying, but that most of the coverage was not dealing with that population in general. Mm-hmm. So when it did turn to talking about that population, it was really quite, it was with these sort of negative framing, as we see in this article. But I really thought that was not the majority of the overall coverage, which I think turns out to be problematic when you look at the way mortality was distributed between the general community, general population, and residential facilities.
Right.
So tell us about part 2 of the special issue. Can you give us a preview or a couple highlights of what to look forward to?
One of the things that's going to be in the next issue is an editorial by Cheryl Zimmerman and Barb Resnick and members of the GSA COVID-19 task force, which had come together really quickly to sort of set a research priority, a research agenda related to COVID-19. And so they're going to comment on the whole collection, but also next steps. So getting back to what we talked about earlier about where is this all going to lead us in terms of research, some of that's going to be in their editorial.
Fantastic.
Yeah, and there are a series of forums in this next one that are pretty interesting. A forum being a more sort of a literature review with a thesis, arguing for a thesis. And one that I think is really interesting has to do with looking at a concept of called compassionate ageism, which I think is relevant to some of what we've already talked about today. This idea that it's sort of a positive ageism, on the positive ageism side of how we can actually, by caring, in a sense, caring too much for older adults, we can disempower. So I think that's an interesting concept that I hadn't really thought about before. And it's nicely laid out in that editorial.
Is that like the concept of doing to versus doing for that comes up in the caregiving literature?
Yes. Yes, I think that is related to that. It's the notion that it's sort of how can I help you, almost assuming that you need help before actually finding out that you do.
Mm-hmm. And that essentially robs people of agency.
Right. They use the term caremongering. And that's the title of it, Caremongering and the Assumptions of Need, the Spread of Compassionate Ageism During COVID-19. So very interesting paper.
Yeah. I'm very interested to read that. Over the past year, over the years, I've had, interesting encounters with people, especially people from the private sector that want to solve the problems of aging through, volunteers and friendly visitors and caregivers using college students and apps and technology. And I think it all sort of falls into that bucket of, shoving aid and care into people's faces.
Yeah, there's a really great example in this article. I commend it to you to look at that. There's an illustration that's pretty well hits home. So, Another one I think that's going to garner a fair amount of attention is called a toxic trend, generational conflict and connectivity in Twitter discourse under the hashtag boomer remover, or the boomer remover hashtag. Which is engaging. One of the things that we talked about when we were writing the call for this special collection, which was that there was this hashtag out there about how COVID-19 would be removing baby boomers, essentially. Right. And so this is taking on that whole notion of generational conflict in the face of a pandemic.
I love it. True to form, the hashtag is off by probably about 10 years.
Yes, it is.
The boomers are probably quite successful if we look at the distribution of mortality.
Exactly.
It's the generation before them that's unfortunately being removed.
And there have been young people also affected, of course. So then there are a few more about stress and emotional reactions to the pandemic outcomes, quite a few of them, actually. There's a whole bunch of them on well-being and loneliness, stress responses, but each bringing something slightly different. It's an interesting collection. Again, international authors throughout. So bringing that international perspective that we so often have in the Gerontologist. I think it's going to be a good read.
Well, Suzanne, thank you so much for taking the time to discuss this special issue. I appreciate it.
My pleasure, Howard. Thank you for asking some good questions.
Thanks for listening. To learn more about the Gerontologist and to read its latest articles, visit the website at www.geron.org. The Gerontological Society of America was founded in 1945 to promote the scientific study of aging, to encourage exchanges among researchers and practitioners from the various disciplines related to gerontology, and to foster the use of gerontological research in forming public policy.